For newly diagnosed patients, what key advice would you share with them? And are there specific questions they should be asking their doctor about their care plan?
Yeah, so I know it's hardest for newly diagnosed patients, right? Most people have not even heard of what multiple myeloma is. They're learning how to spell it correctly and making sure it's not melanoma. And this is a conversation I have with so many of my new patients that I think it's really hard your first visit and maybe even your second visit to ask all the right questions. So really coming home and every time you're on a treatment or you're talking about a treatment and you have a question, write it down. Because I know it's really hard when we're only there for 15, 30 minutes, to talk to you. For us, we have, my chart. So my patients will send questions as I think of them through that. And I think that's really important. It's really making sure you're, sometimes it's hard to know what questions to ask when you have no idea what's about to happen, and that's okay. But I think as you're going through therapy, really making sure that you've asked about alternative therapies that might be available and why someone is picking one versus the other, making sure you know what supportive medications you really need. And I will say that in myeloma, a lot of our treatments are, patient friendly, but they do cause side effects and infections. So we do have a lot of supportive medications we use. So, again, anti-shingles, potentially, if you could get a blood clot, we have you on some type of blood thinner. We have people on protection from against steroids because all of our initial therapies have steroids. We want to make sure you don't get ulcers in your stomach. So we have patients on proton pump inhibitors. There's a lot of things we do to, again, decrease that toxicity. So that's important. And then I think the next part is when you're on treatment, whatever symptoms you're having, keep a log of that, right? Some things are okay. Maybe it's just, a little bit here and there that you're feeling fatigued, but then you're better. But there's certain things that really cause a lot of side effects that my patients sometimes don't tell me about. So the steroids can cause major insomnia for some of my patients where they don't sleep for 3 days, and that's not okay. We can decrease those, right? So there are ways to manipulate the treatments as we're going through to make sure that not only are you having a great response, but that you're not having major side effects that are actually going to hurt your health down the road, right? Yeah. So really important to discuss those things that you're having as you're going through.
There's also the importance of a care partner in your life.
Yes,
right.
I agree. So I joke with my patients that it's real. There's actually a study that shows that men with 3.5 women in their lives do much better in healthcare in general than those who don't. So I'm like, go get more women in your life.
I love that.
Caregivers in general. Yes, men are great caregivers too, but really having someone there that can listen for you and write down those things because it is overwhelming. And when you're on treatment, there are a lot of times when you just can't pay attention, you can't focus, you can't listen to everything. And so having the more people that are there, they'll pick up other things. So a lot of my patients will even have their loved ones on their phone with them, right? Even if they can't be there in person, so that they can record. And, a lot of my patients will record things and they'll ask me. So definitely ask them, whoever you're talking to, if it's okay to record. But most of us will say, yes, that's completely fine, so that you can listen to it again when you go home.